Welcome. We have today with us Dr. Jay User and Dr. Brian Bluth, who are both medical professionals here in Weatherford, longtime affiliation with the Weatherford Hospital. And so in talking with these doctors, we're finding that the situation is very serious at Weatherford Regional Hospital and among our health community here. And the problem is that the hospitals are over capacity with COVID patients. And that's made it difficult when families come in to actually get the care that they're expecting or used to from Weatherford Regional Hospital and our healthcare professionals. Dr. Bluth, walk me through what that looks like when you have a family in the ER with these kind of situations.
Well, funny that you ask a family, it's changed just in the last week. We used to have more than just the patient come in, but right now it's just the patient coming into the ER. So anyone who's sick, and specifically with COVID-19 infection, they're all coming in very short of breath, at very low oxygen and surprisingly low, and they're on their own. And so if you're a family member, you're waiting outside, and you know, of course, we're trying to share as much information as we can, all the time with them, and it takes time. But we're able to treat and manage and help these people feel better in the ER. But it's just not a typical course. This virus is behaving unlike anything else. I've handled patients with flu virus, even flu pneumonia and bacterial pneumonia. We get them in the hospital, give them the support they need, the oxygen treatments, antibiotics, antivirals, and things tend to get better pretty quickly, few days. With this one, it lingers and progressively gets worse once you're to the hospital stage where your oxygen is so low. And it's pretty scary because of all the treatments we use, it continues to progress many times. There are certainly times when it just won't get worse, but it seems to just keep going for a long time, and that's what can be expected. And that's tough as a family members right now. They're all very grateful when we're able to take time and to inform them and update them, but that's what the situation is right now.
Right. Dr. Huser, I notice one of the other concerns is that if you find another hospital that can take a COVID patient, there's difficulty in transporting them there. Tell me what that's about.
Well, what we've experienced, a couple of things. One is trying to find a hospital that is nearby to transport a patient, and whether the Oklahoma City hospitals have all been full to capacity, and we're not been able to find beds there, and Tulsa has been overfull. And I know that this morning that one of the doctors had to transport a patient to Nebraska to be able to find an ICU bed that was capable of taking care of them. Then the difficulties that we've had is first of all, because we're not the only hospital trying to transfer patients to these other facilities, the helicopters are busy. And so that finding them and having either the ground crew or a helicopter to transport these patients has been challenging as well. And then if you go the distance where transporting a patient to Nebraska or to Houston, Texas, where almost happened, you're talking about a fixed wing or an air ambulance that you have to find. And that becomes difficult. Securing one in a timely way when these patients are critically ill.
Right. So, the numbers spiked again this weekend. I think that was kind of anticipated because of the Thanksgiving holidays. And, some of this should not come as a surprise to us. I think we've been kind of told all along as you go into fall, winter, holiday time, families getting together, different activities, this is going to happen. Dr. Blue, talk to me a little bit about social distancing, of what can actually be done, even if the masks are not the primary focus.
So we do know that there is something about being near other people. most people do have some kind of symptom, and there is some upper respiratory trigger that someone might know that there's something not quite right. And whether or not they think it's just an allergy symptoms or a regular cold or whatever, you just can't go around anybody at this time, because if you happen to have coronavirus infection and you give it to somebody, I have a patient in the hospital right now, an otherwise healthy older lady who was going to the Y, walking with her friend, and her friend felt sick. But there's this belief that even if you're just feeling a little bit ill or not feeling any symptoms at all, and you're not sure if you have anything or not, and you may have it and not know, you get near somebody that could potentially get very sick from this and have to be hospitalized and get severe. You just can't do that to people. You have to keep the distance. You have to respect and honor others and not just worry about your own freedoms. It's almost like freedoms become a selfishness right now. And whether or not the mask works, I get it. There's types of masks. There's ways we all wear the mask. We touch them, we reach underneath them, we remove them. As soon as you do that, you've contaminated the mask. You have to either wash it again or sanitize your hands. There's something about just sanitizing your hands as soon as you touch your face or your mask or other surfaces, because we know that the droplets get onto surfaces. The supermarket is one of the biggest, studies have shown it is the largest source of infectious spread, the supermarket. So, early on, people were wearing gloves, they were wearing masks or whatever. We have to continue that, but do it right, because you'll wear the gloves and then you'll touch something and then you'll touch your face with the gloves on. You got to sanitize if you're touching something. You got to keep distance from others. In these gatherings, I understand the importance of family, of psychological needing to be near those you love and talk, but right now there's a chance that you're going to give somebody you love an infection and cause a severe critical situation. And so you need to be respectful of that at this point and avoid it.
Yeah. Well, Dr. Huser too, I know that physicians are concerned about the overall well-being of their patients, their mental status, their happiness level in terms of dealing with this, because it's very trying and difficult for a lot of people. So taking that into consideration, do you feel like people can still function day to day, still with these precautions?
Oh, I absolutely do. And it does take modifying how we do that, but it can certainly be done. I think we can still shop. I think we can still go to the grocery store. I still think we can go to church. I do think masks are necessary. I think they're very, very important. I think that good hand washing, like Dr. Blue said, is important. And I do think the distancing, respecting that recommended 6 feet of space is important. None of these things are perfect. And we do them inconsistently. And that's a problem. And I've had people point out that, well, we're not doing this consistently, so how is this even going to be effective? We don't have the rule book for the coronavirus, for COVID, because we've never experienced anything like this before. But I think we do it as well as we possibly can. And we're not going to stop the spread of this virus, but we absolutely can slow the spread of this virus and avoid these peak numbers like we've seen this past week, where the numbers are high. And we're going to continue to see the aftermath of that, because one of the things that we have experienced is that people may test positive and start getting better, but then 10 to 14 days later is when we start to see more of the respiratory problems and the hospitalizations coming 10 to 14 days later after their initial diagnosis. So we can certainly do our part as individuals in limiting and slowing the spread of the virus.
Right. Well, along that, Dr. Huser, along that line, there is some discussion on changing the quarantine dates from 14 to 10 days.
Yes.
Do you think that has any merit?
Oh, I absolutely do, because people are shedding the virus early in their the day before they actually become ill, the day of their illness is in that first 24 to 48 hours is kind of the peak shedding of the virus. And then the viral load, the viral shedding slows down, decreases dramatically with time. And now that 10 days is assuming that you're feeling better and you're not running fever. If you're still at day 10 have a fever, then no, you can't say, oh, well, I'm better now, I'm not shedding the virus. But many individuals are sick for 24, 48 hours. And yes, by day 10, it's fine for them to be out.
Yeah, makes sense. Dr. Bluth, there's a lot of discussion about the testing strategies now. A lot of the testing sites, and we have a few here in Western Oklahoma, are stressed as well. Tests can be limited at times, and it's difficult, especially following Thanksgiving activity where we've been around a lot of families. So what are you telling your patients now in terms of if they feel like they want to have a test? What do you need to know from them?
Well, there's no one size fits all. Honestly, for example, right now I'm telling my patients, if anyone comes in and tells me they have a loss of smell or a loss of taste, I tell them, you have COVID-19. There's nothing else that does that right now. No need to test, no need to come to the clinic or go to the hospital. That's what you have. And you stay home in quarantine for 10 days. If they get other symptoms, other respiratory symptoms, for sure, call us, go to the hospital if you need to, and we'll take care of you and manage that. Now, when it comes to other symptoms, like I was saying before, and you just cough, cold, congestion, and you're thinking, well, this is nothing. This is what I get every year. My allergy is acting up, especially fever along with that. You need to go get tested. And what we're recommending as medical professionals is to get the PCR test. It is the most accurate. That's the test that takes 2, sometimes 3 days, but sometimes it comes back as quick as 24 hours to get the results. And you just basically have to stay home, quarantine yourself until you get those results. Assume that you're positive until you get them. Now, I think it's okay to do the rapid test, but because it's sometimes inconsistent, I would suggest if you have symptoms and you have a negative test, then get a PCR to confirm that. All right, that's what I'm telling my patients. I'll recommend that. Sometimes I'll have them do both, do the rapid first, and then if it's negative, go back and get the PCR right after and quarantine still until you know for sure that you don't have it, because again, it's just not worth the risk to give it to an office and, close down that business or give it to a loved one that could end up in the hospital. I mean, there's so many facets to it. It's not just the ones in the hospital, not just the difficulty we're having there, but functioning and keeping businesses open. And we want to control this, because we want things, the economy to keep going. And along Dr. Huser's lines where, maybe we can slow down the numbers. I think we've kind of already let that ship sail as far as Thanksgiving. We weren't good enough, I don't think, to calm it down. So we're going to see a surge. That's going to happen. And to go back to your early question about what families can expect in the hospital, please know that there are no places to send your family members now. And in a week or two from now, it will be worse. And so we're able to find a Nebraska or a Houston right now, but that's going to be gone. And so what do we do with these critical patients? And there's going to be multiples. And it's going to be a tough situation. And we ask people to have patience with that, understanding and recognition that we're going to do the best we can, and we're going to try our best for each person and care. But that also comes with we don't know. We don't know what to do next sometimes.
Philip, can I interject? I do want people to know that the care that has been given at Weatherford Regional Hospital has been excellent. The patients have been receiving the top quality care that they're accustomed to, but with our facility and with the equipment that we have, we do have limitations. And prior to COVID, we transferred patients to Oklahoma City for a higher level of care for a variety of illnesses and a variety of conditions. And we continue to do that now. But the care they're receiving is top quality, high quality medical care at our hospital. The nurses are doing an exceptional job. And I don't want them to think that if they're admitted to Weatherford Regional Hospital, oh, they're not getting good care. They're getting top quality care, but there are just limitations that our facility has because of equipment and staffing and the size of our hospital.
Right, right, very true. So Dr. Huser, following up too, you know, I feel like people need a little bit of ray of hope. Are you optimistic about the vaccine, and what can you tell your patients about the vaccine?
I think the vaccine absolutely is offering promise. And I believe it's December 9th that they're planning on meeting and making the final determination and final approval of that vaccine. There's the results are showing a 90 to 95% efficacy in preventing the virus. And those are high numbers for a vaccine. So that's extremely promising, extremely promising. And I know that the newspaper did a poll and people were very mixed on whether they would take the vaccine or whether they wouldn't take the vaccine. And I think that's unfortunate because I think this is something that we need to do to get ahead of this virus and the spread and the numbers that we're seeing. So it is promising. It is promising, absolutely.
And I'll add to that. I think I understand skepticism and people worrying about something that's new and different. But I'll say this: I think Operation Lightspeed, that was spearheaded by Trump's administration, was a complete success. I mean, they have revolutionized how these things are studied and tested and managed. Just like in 1918 with the pandemic, then there were scientists behind the scenes. I read through some of the history of that were revolutionizing medicine then to try to fast track how to solve the pandemic problem and fix it and get it over with. Same thing is happening now. It's changing medicine. It's changed the technology that's being used to safely bring in a vaccine quickly. And so that's why I think this is going to be a game changer. But it's not going to be available for everyone in December. You know, it'll be for high-risk people and certain medical care personnel in higher areas. So it'll take time still for all of us to get it. So it's going to be a little bit of some time still for, till it calms down, but it will. There's definitely hope.
Yeah, absolutely. Well, I noticed that we have Dr. Marshall Huser is tuned in. He may be in between patients and just kind of curious if his dad is saying the right things or if he should correct anything. he's just here for that.
He keeps me updated with the latest information.
Yeah, right. He does. He's
right. We certainly appreciate you all and what you do. I know it's going to be extremely stressful dealing with life and death situations like this. And not knowing, as you both have said, so much about this virus and how it can change and morph into something else. So it's a difficult situation, but I appreciate everything you all do, everything the hospital does. Is there anything else you need to tell us or anything that
I just want to reiterate what Dr. Huser said about our staff at the hospital. We have excellent facility and top-notch quality equipment, and we can take care of high-level, difficult cases. And the nurses are excellent, and they're overworked and overstressed. We've never been busier, and they're still doing an amazing job. Our respiratory therapists, ER physicians, whole staff, and you will get the best care there by caring people. We have those limitations of certain levels, but until we get there, it's a great place to be.
That's right.
And it sounds like we as a community then need to do the right thing. Sounds like
we do
take every precaution we can to not put more stress on our healthcare community, on our hospitals, and by just practicing some simple precautions of social distancing, masks when possible, cleaning hands, all those kind of things come into play, so we can all play a part. And in doing so, we kind of acknowledge those that we've lost to COVID. You know, we've had more deaths that happened this weekend. So because of that, you know, we can all honor their deaths by taking these precautions and doing what we can.
Yes.
So I appreciate it. Everything. So Dr. Huser,
one last parting shot. I just want to again reiterate the fact that people cannot dismiss their symptoms as their average. This is my annual sinus infection, or these are when my allergies always flare up. Not this year, not in 2020. Can we just dismiss those symptoms as my usual? We need to test and prove that it's not the coronavirus. And then we can say, okay, yes, it is. It is your annual sinus infection or your annual allergy flare up.
Right. But for the sake of your family and coworkers and people you're around, do the right thing and get the test and
absolutely.
Keep everybody safe and stop the spread.
Yeah,
for sure.
Absolutely.
Yeah. Well, thank you all again. Appreciate your time, and keep up the good work. And we look forward to hearing from you again.
All right. Thanks, Phil.
Thank you.
Take care.